Hello, listeners. Welcome to Views on Health. And as a new year, 2022 dawns, we're with you back on the program. And it's a great pleasure to have with me tonight Dr. Kishara Gunaratne, consultant neurologist and a senior lecturer, Faculty of Medicine, University of Moratuwa. As a consultant neurologist, Dr. Kishara Gunaratne is going to focus on his specialty. But before that, I would like to take this opportunity on behalf of the Sri Lanka Broadcasting Corporation to wish all of you out there, our audience, a year full of good health. And let's hope and pray that the COVID pandemic will leave the face of this earth. Welcome, Doctor, to SLBC and our program.
Thank you very much.
And the focus tonight is on epilepsy. A question, Doctor, at the very outset: how common is epilepsy? Who's affected? To our knowledge, there are children affected, there are adults affected. In between, is anybody else affected? And also, is it a gender-specific ailment, like more males, more females, more girls, more boys? And obviously, you want to focus on this because you see the need to create the awareness amongst our listening audience. Over to you, Doctor.
Yeah. With regards to how common it is, well, what I can say is that approximately 50 million people worldwide are affected with epilepsy. And when it comes to Sri Lanka, what we think is the estimated population that could be affected could be around approximately 100,000 or more. And some experts say that it may be around 200,000, but we don't really have very accurate data to suggest the accurate prevalence or incidence of epilepsy in this country. So I would say maybe around 100,000 the least, or the minimum number that would be affected. With regards to who gets epilepsy, anyone can be affected with epilepsy, but there are two peaks in which epilepsy is more prevalent, as it were, and that's during childhood, where the very young and also the very old in patients or people actually over 65 years of age are the two peaks that we see epilepsy the most. But we can expect epilepsy at any age, and that's the biggest worry, where anyone can be affected with this ailment.
And you said in between as well.
Absolutely.
How does it happen?
How does it happen? In the sense, there are many causes for epilepsy. For example, if it's say for the young adults, traumatic brain injury can be a cause for epilepsy. For example, they have an accident, they lose consciousness, they hit their head. Maybe a few months later, they start seizing, and then they're diagnosed with epilepsy. For the older adults, say they might get a stroke, and as a consequence of the stroke, a few months later, they might have seizures, and that might be a cause for the epilepsy. For the very young, when a child is born, they might have less oxygen going into the brain, or they may be afflicted with an infection, maybe an infection to the brain. So the causes are varied, and there's a wide spectrum of causes, and depending on the cause, the type of epilepsy.
Thank you, Doctor. Now, when you take the problem per se, and there is an onset of it, and then you described how they can be affected, they can fall. So in a case of somebody who falls then and hurts a limb, or maybe can hurt their head, can be head injury. So such people will, obviously the medical personnel, the doctors concerned, will have to deal with two problems, epilepsy and the injury. At the same time, when they do present themselves with the problem, immediate medical attention may not be possible. It might happen perhaps in the house, at a place of work, at any other given place. Definitely not maybe not at a hospital, maybe rare if it does happen just for the first time. How does one cope with it?
Yeah, so I think what you're asking me is, well, how would we handle a seizure?
That's right.
If we see a person having a seizure, what should we do? What should we be doing? That's a very important question. What we need to do is, one is that we have to be calm, right? So the person who's attending to that particular person needs to be calm and collected. What a lot of people do is there is this myth that these people with who are experiencing a seizure should they give us something, they put in a spoon into their mouth to prevent them biting down. Some people give something into for the person to actually hold on to. These may be actually dangerous, deleterious. They may actually cause more harm than good. So what we advise people to do is not to actually give anything into the hand. Don't push anything into the mouth to prevent the patient from biting down, because that can actually worsen the situation. What you need to do is basically make sure that the patient is, or the person who's seizing is lying flat on the floor, maybe to the side, maybe to the right, maybe to the left. Make sure that there are no objects that the person can injure themselves with, and basically time the seizure. That's very important, because often seizures self-terminate. They don't go beyond 2 minutes. An average in which a seizure would occur would be approximately 1 minute. But if they go on for more than 5 minutes, the chances of the seizure really stopping by itself becomes remote, and that's when the particular person needs to be rushed into hospital, because that particular patient or person would need medication to be pushed in through intravenously to stop the seizures, because those seizures are the most dangerous, and those are the seizures that can cause permanent brain damage. So the most important thing is timing the seizure, making sure that the patient is in a safe environment, making sure that there aren't any objects around the person, and also not really pushing in things to prevent the patient from biting down or giving objects into the hand, because I think there are lots of people who actually give various things, iron rods, small ones. There's this myth that stops the seizure. Seizures will anyway, 99% of all the seizures will self-terminate. They will stop by themselves. So you don't really need to treat them at that point of time. But if the seizures are prolonged, that's the time when they need to go into hospital. And the 1990 ambulance service is really good. They transport these patients very quickly to the closest hospital.
Doctor, would these seizures recur?
Yeah. So seizures. What I need to really elaborate and draw your attention is to the difference between what a seizure is and what epilepsy is. So a seizure is something that a person would experience as a result of abnormal electrical activity in their brain, right? And epilepsy is a diagnosis that we make in a person who has the propensity to have these seizures, more and more and more. So with time they will have 1, 2, 3, 4, and so on and so forth with time. So a single seizure, a person with a single seizure is not really a person. We will never diagnose those patients as having epilepsy. But if the patient or the person gets more and more seizures, that's when we actually diagnose these people as having epilepsy, because those are the people who really need long-term medication. Furthermore, approximately 10% of the population will experience a single seizure throughout their life, and that does not mean that they are epileptic or patients with epilepsy. Out of the 10%, approximately 2 to 3% will have epilepsy. So the majority will have a single seizure, but not have a further seizure, throughout their life. But the 2 to 3% of the population will have recurring seizures, and those are the patients that we need to be worried about, and those are the patients that need to be referred to a specialist so that we can start on medication to suppress those seizures.
Doctor, you spoke of 2 peaks.
Yes.
So the first peak is when they get the seizures when they're children.
Of course.
And then the over 65 age group. Now, if children get it, and obviously you'll be treating, but will those seizures continue for life? I mean, they're under medication, but will the seizures be controlled? Yeah. Or will they still even come at sort of, between long intervals?
Yeah. It's an interesting question. So there are various types of epilepsies, and it will really depend on the type of epilepsy either the child or the young adult or the older person would have. So it depends on really the type of epilepsy. For example, I would suggest there's a type of epilepsy that affects young children where the onset of the epilepsy occurs approximately at age 5, 6, and this type of epilepsy, the patients or the patients involved have seizures which are very brief, short-lasting. They would generally stare into space for a few seconds, and then they're back to normal. And often during school, the teachers pick it up, but they often don't attribute this to epilepsy. Where they find that the child is not doing well at school, they would generally blank out for a few seconds, then come back, and that might occur several times during the class, during the period in which they are being taught, and that will be attributed to daydreaming and so on and so forth. But what really happens is that this patient or this child is actually having seizures throughout the day, multiple times a day, and as a result affecting the cognition and scholastic performance of that particular child. Now, this type of epilepsy can be easily treated. There's medication for this, and also it's what we call age limiting, where by the time they turn into teenagers, the epilepsy stops. And we don't really, particular people or children don't really need long-term or what we call medication to suppress the seizures. Of course, there are certain other types of epilepsies. For example, an epilepsy called juvenile myoclonic epilepsy occurs often during teenage years. That's when it starts, but those people or patients will have epilepsy for life, and for them they will require what we call anti-seizure medication or treatment for life. So it depends on the type of epilepsy or what we call the epilepsy syndrome that the patient has. I hope that answers the question as to whether they will need it for life or whether it's a short-term treatment that we're looking for.
Those in between, now it can happen to anybody, and I mean, just somebody just doing something and he or she can suddenly get a seizure. What triggers it off?
So as I said,
the same causes.
Same causes that can be the cause for the epilepsy. Sometimes we don't find a cause, but generally the causes can be divided into several broad categories. It could be genetic. For example, it can be brought on by genes and brought on down by the generations. Oh, there can be a structural problem in the brain, so that's why we generally do scans, brain scans, to find out whether there are scars in the brain that can cause the epilepsy. So it could be a structural cause. It could be what we call inflammatory, where the immune system is dysfunctional, and the immune system actually attacks the brain and causes epilepsy. It could be an infection that can cause epilepsy, and sometimes it could be a metabolic cause where certain metabolic derangements within the body can cause epilepsy, and sometimes we don't really know. So several broad categories as to why epilepsy occurs. Of course, there are certain triggers that can trigger seizures. Say, for example, alcohol. For some certain types of epilepsy, alcohol can be a trigger. So every time they indulge in alcohol, they are at higher risk of having a seizure. Sleep deprivation. If they don't get enough sleep, they can have seizures. If they're tired, excessively tired, again, anxiety, stress can trigger seizures. For certain types of epilepsies, flashing lights. Say, for example, if you're going down Gaul Road, you see the flashing neon lights, that can cause or trigger a seizure. So those are what we call triggers. But they're not really the cause for the epilepsy, but they are definitely triggers for seizures, and we need to really sort of tell our patients that these may be your triggers, and you need to modify your life, or the patient needs to modify their life accordingly.
Doctor, yeah, it can impact on one's life in several ways. If you're an adult, and if you're working somewhere or you want to work, and if your health record says that you're prone to seizures, it can impact on their career. Similarly, marriage. It could be the male, it could be the female, and either way. So would it impact on a pregnancy? Will there be difficulty in becoming pregnant, or there won't be a difficulty, but would it impact on the fetus?
Yeah, that's a very good question. So epilepsy does really impact on fertility. The epilepsy per se can affect fertility. There's also the stigma which is, I think, the greater impact that affects fertility. So throughout there are several studies that have been done throughout the world that have actually substantiated the fact that patients with epilepsy are less fertile, and that may be not because of the epilepsy per se, but the other socio-economic circumstances that come with epilepsy that might actually affect fertility. Of course, if a patient with epilepsy does get pregnant, if they're on the right medication, the outcome of the pregnancy in the majority of cases is a favorable one, as long as they've been managed or treated properly, and they're being monitored right throughout the pregnancy. I think in most cases the outcome is absolutely favorable. So the main message that I'd like to share with our listeners is that patients with epilepsy can get pregnant. It can be safe, but as long as they refer to the correct specialist who is able to monitor the progress of the pregnancy, and as long as the particular person is on the right medication, the outcome will be often good.
Just one final question, Doctor. How well is the medical treatment available, how well are you, when I say you, the doctors involved in this process of treating such patients, are geared to give them the facilities they need, the advice they need? Are there sort of other care sort of programs so that they are aware as to what they should do, what they shouldn't do, to ensure that their life as well as the baby they are carrying will be, safe?
So these patients really need to be referred. So once so the care of such patients should actually start prior to conception. They should be referred to a specialist, either a physician or a neurologist. It may be a pediatrician if they are children, in the younger age category, less than 18, of course. But generally, they should be referred to a specialist. And with regards to the services that are available in Sri Lanka, I think there are specialists all throughout the country, and services for epilepsy are indeed available. And it's often a team effort where it's with the conjunction of the obstetrician, the neurologist, or the physician that needs to sort of occur, and that's really available throughout the country. It's just that the people need to be aware of this and plan their pregnancy, and need to go to the correct specialist and discuss their options of fertility prior to conception.
Thank you, Doctor. On that note of advice, we end this interesting discussion on epilepsy. Thank you so much to you, Dr. Kishara Gunaratne, consultant neurologist, senior lecturer, Faculty of Medicine, University of Moratuwa, for sparing your valuable time to be with us on the program and to share your knowledge with our listeners on this particular topic. Thanks so much, Doctor.
Pleasure.
My thanks also go to Achala Gunasekara for technical assistance. I'm Fatima Razi saying good night and hoping to be with you next Monday, same time on Views on Health.